We've become accustomed to hearing the same stories about Montreal emergency rooms, the overcrowding, the stress, the delays. But rarely do we get to know the people on the front lines, the hospital workers who have to deal with the situation every day. In a CTV News special report, Cindy Sherwin spent some late-night hours following doctors and nurses at the Royal Victoria Hospital's ER to find out just how they do it.
Emergency?
Inside the emergency room at the Royal Victoria Hospital,
I have a patient who is more appropriate for there.
A well-choreographed dance is underway.
So let me look at the x-ray first, okay, and see your white count, then we'll make a decision.
Time flies, you know, it's busy, it's crazy, but I love it.
Hello.
In order to understand why these professionals thrive in this environment,
how are you feeling now? Better, worse, same? Better. Okay.
It helps to understand who they are and just how much they can handle.
You're essentially holding on to a bull, and every once in a while it kicks, and that's a fun ride.
What you do is you go weeks and weeks and weeks and weeks without seeing anything that's at all interesting or stimulating. You get that one case that just blows your socks off.
Life in the ER, they say, is as simple as ABC.
A is airway, B is breathing, C is circulation. And when someone's acutely ill, it actually becomes quite simple because you just have to fix the things that could kill them.
Take a big breath.
But what ranks as ordinary to the staff feels extraordinary to those who are sick, who crowd the hallways and fear the worst.
Okay.
Thank you.
Thank you, doctor. Over a 12-hour period, we followed and observed the ER team as they juggled a dizzying array of tasks.
Okay, next.
There are certain medical issues that come up in the ER every day, heart and breathing problems, gastrointestinal bleeding, but each person, each case is unique.
Today, I saw this patient with chest pain, saw people with an aneurysm that was leaking.
People who have brain tumors.
We got this agitated patient who was picked up at Dunkin' Donuts who's likely to take some drugs.
He's here because he's dehydrated.
2 patients who are in heart failure.
And you just get that all straight for me.
Yeah. You have a pain?
Dr. Marc Beyik, a former head of emergency, is working in acute care and says this is a run-of-the-mill day.
You have to know what you're doing in this kind of environment so that you can be calm when everything breaks apart.
They scare the hell out of everybody. You're normal.
Down the hall, Dr. Fred Dankoff, the interim head of the Vic's-ER, is just beginning his evening shift.
You seem very energetic. Are you?
The nurses hide my coffees. Is this guy one of yours? That's all I'm asking.
A good shift, Dankoff says, is when he can work non-stop, helping as many patients as possible.
People think like, oh my God, I can't believe you do what you do, and it's actually not true. When I look at a desk like my account, I'm freaked out. I'm scared. You know, it's not that we're special for what we do, it's that we thrive in the environment we like. He's not just a reassess, or he needs a real room.
This is minor care, designated for non-critical cases, but they can't let their guard down.
There's no explanation how she goes from headache to arrest, so I don't want it to happen back here. Our residents often, we have to teach them that this area is just as dangerous as that side.
And danger comes in different forms. It may be lurking while placating a well-dressed professional with a problem.
Alors, de l'après-midi. Allez, couchez-vous là.
No. So there was no excitement.
Well, he's quite drunk. He's not sure whether he wants to stay or go, and he's not sure whether he's drinking or not. So.
That patient was responsible for a code white, an alarm that sounds when a patient becomes too aggressive or violent.
Code white, all clear.
And it happens up to 5 times per shift.
Have you felt threatened before?
Yeah, I've been assaulted a few times. Then you learn to pick up the signs and try to avoid it.
But the bottom line is I'm walking to the back so I can pull the chart and tell you what the story is.
Dr. Mitch Schulman, who's been racing up and down these hallways for the last 30 years or so, says even plain old rudeness can wreck his day.
As long as people are all working together, I can put up with almost anything in this department.
And collaboration is essential, but not always easy when you want a test result now.
The lab may not want to do it. You have to call them and demand that they do it.
Or when, like Dr. Zachary Levine, you're trying to get the psychiatry department to accept a patient.
He is in recess 1. Everyone wants to minimize the overburdening of their staff.
So sometimes there is this negotiating, this tap dance.
Always.
But overburdening is unavoidable.
When 2 is empty, she's going to go there.
Like when nurses work a 16-hour shift.
It's real. It's real. I mean, we live it every day. We're constantly working overtime, and but what I like is we're not forced to do it.
It's especially hard when the patient board is full.
4 or 5 patients per nurses, it's reasonable. Yeah. But when you go double, it's not. It's not safe for the nurse. It's not safe for the patient.
Hello. It gets to be a little frustrating at times, and especially if you're the type of person who wants to give good care.
What's really stressful is not the medical condition. It does not stress me to see a cardiac arrest. I'm trained to do this. This is what I do.
Is the next one who's going to get a bed down there?
But overcrowding equals stress. There is room for other emotions in the ER.
And every now and then there's a case and it just breaks your heart.
Tonight, it's a teenaged girl.
Took an OD of 15 grams of Tylenol.
She had a bad experience with a boyfriend, and she got very upset, and she just made a poor decision.
With treatment, it appears she'll be fine. When shifts wind down, it's time to shift gears.
I'm going to go home and play with my dog.
And are you exhausted?
Not yet.
Do you ever get exhausted?
I think. No, not too much. Girlfriend complains about it because I go home and I'm still hyper from here. And actually, most of the physicians here will tell you by the time they get home, they're still wired.
That's when decisions are replayed, faces recalled.
I've burned out, and a lot of people have burned out. But my passion is the emergency, and I'm glad I hung on here.
Amidst all the pain and discomfort, they all hold on to make some difference, to make it a good night in the ER.
We're not done. Night.
Cindy Sherwin, CTV News.